we are ready to begin, or shall we take some time more? Hello, everybody, and a very warm welcome to all of you at this orientation program at AMI, at Shvaas. Namaste to all my teachers and seeing here senior and my colleagues, a big hi to all of you. Before we talk about Shvaas, which is the breath, let me talk about us. So for those who do not know us, we are AMI Yoga. AMI stands for Awaken and Maximize Inner Potential. Ami in French means a friend who is by your side, help us develop, awaken, maximize our inner potential. The journey of Ami Yoga began with Usha ma'am, the founder of our institute, about 35 years ago. What started at Usha ma'am's home with a set of small batch of participants. Can we have the spotlight on Usha ma'am? Yes, namaste ma'am. So what started with ma'am's home as a set of some students took shape of Yog Sadhana Kendra. Predominantly, Yog Sadhana Kendra operated in the city of Mumbai, suburb Chembur, with about 1,200 participants over the years, regularly taking benefit of the science of yoga, led by all the teachers of AMI Yoga, and the team of teachers keeps increasing. Usha ma'am still motivates and inspires all of us. I'm sure some of you do know that. She so much takes care of herself, and with her practices and with her creativity and innovativeness, she develops practices that help recovery and promote health. Thank you so much for that, ma'am. And very much rooted in the science of yoga with the Bihar School of Yoga practices. Since about 4 years, Yog Sadhana Kendra has been turned into AMI Yoga. And that's where Megha Dhargalkar, Usha ma'am's daughter, has taken over all the operations. She is the Chief Vision Officer. Can we have the spotlight on you, Megha? Thank you, and hi, Megha.
Hari Om.
Hari Om, Hari Om. So Megha by education is a pharmacist. She's a management student as well. She's taken her management from the Jamnalal Bajaj Institute. And post that, she's held very prestigious organizations that she has worked with and holding very senior positions, handling huge teams. But somewhere around 4-5 years ago, she found her calling in yoga. Yes, Megha. And very much rooted in the science of yoga from the Bihar School of Yoga. Megha is a level 2 yoga instructor from the Ayush Ministry, Delhi. Megha's strengths, I must say, lie with her dedication and sincerity that she gives to the subject. She almost gives her 200% to the subject, making the process of learning so much more easier for the participant, and in turn, she enriches herself as well. Megha's strengths also are special batches and therapy classes. I would like to mention here joint pain workshops and diabetes batch, which is a continuous ongoing batch. She's been handling with the team of teachers and getting all beautiful results with yoga and diabetes. Apart
Thank
from
you,
that,
Sima.
thank you, Megha. Coming to myself now, I'm Dr. Sima Thakkar. I am a homeopathic practicing doctor and a level 2 yoga instructor. I've also a master's in yoga therapy for doctors from the Swami Vivekanand Institute, Bangalore. The spotlight can be on me now. So my strength, I believe, is important in connecting the science of anatomy and physiology and the disease to relating it to the yogic philosophy, where we can draw a line, where we can intervene, how we can bring recovery. Those form my passion. And together we are all with you with this process at AMI Yoga here. AMI Yoga's strength has been always in the community, corporates, and in the teaching profession. Being online sessions now, we all agree that world has become a global village. And in all our sessions, we have participants coming from all across the globe. It's very heartening and it's very really enriching as well. So we have participants, about currently 500 plus participants in all our online courses, special batches. To mention, as we talk about special batches, I would really want to say that in this times, we have an ongoing journey to recovery batch, which specially focuses on post-COVID participants. I have been handling that batch, and we notice how with practices and intervention at yoga, can we bring a change in those participants with fluency? We will come to that a little more in details. Apart from that, Ami Yoga's presence is also in the corporates, where not just for physical relaxation, but what is the role of yoga at the level of mind, at the level of intellect? How clarity of mind is going to help top corporates, executives, senior people in the industry to bring more clarity in themselves, to increase their creativity and productivity at work. Talking about our teaching courses, we have these continuous ongoing level 1 and level 2 teaching courses from the Yoga Certification Board, Ayush, New Delhi. Yoga level 1 is a protocol instructor course, and yoga 2 is a level 2 is a yoga instructor's course. Our batches are attended by really participants from all over the globe in this current situation. So with this forms a little introduction about us. And as we say that before we are starting something, we need to do little preparation, right? So now we are going to, like, suppose if I have to clean my home, first I need to prepare something, get the material right with me, and then begin with cleaning my home. Today we will begin our session with a preparation followed by a prayer, which is a Guru Mantra. So get ready, whichever place you are sitting in. Just stabilize your body. Get ready, everyone. The only prerequisite is your back is tall, spine is straight, chest is open. Take 3 deep breaths. Inhale deeply. Exhale completely. As you focus on your breath, automatically notice the body becoming more stable. The breath becoming more longer, deeper. The mind becoming more silent. More the silence in the mind, more the stability in the body, and more the body becomes stable, the mind further silences. We will chant the Guru Mantra. You can listen to the chant of the mantra. Be in your steady pose. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Gurur Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Om Shanti, Shanti, Shanti. Gently join your palms in the center of the chest. With exhalation, bow your head down. Open your palms and place your warm palms on your closed eyes. Take the warmth of your palms to your eyes, face. Whenever you are ready, you may open your eyes. Thank you, everybody. Hari Om. And over to you, Megha. Just one little thing. It will be good to see many people with their videos open so that we can see you. But again, it's your comfort. Yeah, thank you, everybody. Thanks. Okay, over to you, Megha. Thanks.
Thank you, Sima. So with this, let me just tell you about how we will go about today's program. I'll explain in brief what the contents of this workshop are going to be. After which, Seema will talk a little bit about the COVID therapy and what we are going to teach you in the COVID sessions. Because being respiratory therapy workshop, now COVID becomes a very integral part of this whole workshop. And then Usha ma'am, she's going to share a couple of experiences with us in her long journey and very large experience of handling different kinds of respiratory patients. And after that, we will throw the floor open for questions. You could either ask them from the chat window and we'll try and address them, or you could unmute yourself and ask your question. So let me just brief you a little bit about the contents of the course. I'll just share some slides with you. So while we are talking about content of the course, basically, firstly, we will be understanding, because we are all yoga teachers here, and therefore a little bit about the difference between the yoga that we regularly teach and yoga therapy. So being very clear about now, as an organization, the yoga that has been taught here for the last 35 years, the belief has always been that when it comes to yoga, it is not just about teaching some asana, some pranayam to a participant to feel better. Because we find regularly, very often, don't mind my saying this, but yoga teachers tend to think, okay, if I teach this set of asanas and this set of pranayams, then my patient or my student is going to get better. So what we try to do is really understand the psychological makeup of the student. What is going through the mind? Because very often 80-90% of the time ailments are driven by the minds. They are not just driven by the physical part of your body. So understanding psychological makeup of the student, and then of course understanding the physiological makeup of the student. So what is that physical ailment that the student has, and how can I make that better? Uh, we will have sessions which deal with lifestyle modifications that a yoga teacher can suggest to students who have respiratory ailments. So you find very often when there are respiratory ailments, there are triggers which cause problems. And these triggers are often situated in our lifestyle, in our social interactions. So dealing with those lifestyle modifications will be a part of this course. Counseling. So as I mentioned earlier, we don't think that it is only about, teaching some asanas and pranayams, being able to talk to the student, understand the student, and then be able to provide triggers which can help student recovery. That's an integral part of this course, and that is what we believe that one needs to practice. And that is what Usha ma'am has been practicing, and that's what she has taught us over the years. Now, one unique feature of this course is also going to be the role plays we will be enacting. So Dr. Seema and me, between us, might enact a few role plays and then have some of you come in to enact a few role plays as well, which help you to understand really how you can deal with the student, to understand what are those factors that might help you work upon to make the student feel better. There is going to be a live sharing of case studies encountered in our experiences. And I must say, this is where Usha ma'am will play a big role, because her almost endless experiences with a very vast number and varieties of students. We will all get to learn from those as well. Of course, anatomy, physiology of the respiratory system and the immune system, because not just COVID, but also when it comes to the respiratory illnesses, infections, upper, lower respiratory, tuberculosis, then all these aspects involve the immune system. So the respiratory system by itself is not enough. We also need to know the immune system and understand it better. Dealing, of course, with kriyas, which can help the process, asanas, pranayam, breathing practices, different kinds of meditations that you can take your student through, which might help him or her recover from the whole process. We believe that mantras play a very important role in healing. So when it comes to mantras, they are quite, what as I would say, a-religious, because yoga doesn't believe in a religion. It believes in energies and healing energies and the manipulation of energies within to produce better effects within us, to evolve ourselves. So mantra healing is going to be about that, how you can use simple mantras to heal and to get your students to use them very effectively. Auto suggestions, because when the mind is involved, then what you say to yourself, it plays a big role. Now, typically we follow practices, I would say almost completely from the Bihar School of Yoga. And that is the philosophy and the practice we will be teaching. But we will also be incorporating a couple of practices from the Svyasa school. So pranic energization techniques, deep relaxation techniques, which Svyasa practices and has found very good effect in their therapy courses. Those will also be introduced here. Yoga Nidra techniques, what kind, how do you design your Yoga Nidra and how do you give a Yoga Nidra to a student to really make, produce effect? Of course, COVID management, healing, recovery for more about this, so I won't cover this aspect much. And then we have some outside faculty who's going to talk about just about an introductory approach to Ayurveda, how it can help respiratory healing. Naturopathy techniques, maybe simple tips on what a yoga student, a yoga teacher could use. Acupressure principles. We all know that the meridians run through the bodies, and yoga itself has all the principles of the nadis. So when it comes to acupressure, definitely there are very powerful healing techniques available there. We have a good acupressure therapist who's going to teach us for a couple of hours different principles and healing with acupressure. And then we also have sound healing. So using music as therapy for overall healing may not be just respiratory, but how do you heal a patient or a participant? So these are, this really is providing a whole repertoire of instruments to a yoga teacher to be able to deal with his or her students. Now, there is also going to be 2 weeks of project work, maybe not exactly 2 weeks, but the idea here is that if you are already teaching, pick up 2, 3, 4 students whom you are teaching who have respiratory issues. And very often what happens is all our evaluation, it is very anecdotal. Oh, so and so came to me, he or she was not feeling well, I did XYZ, and then the student felt better. But really, do we have a solid evaluation technique of such a student? So pre post evaluation parameters, how do we go about really making sure that the patient has on the selected parameters improved? And this we feel is a real gap when it comes to yoga teachers. So we all like to feel that, yes, we have produced very powerful healing for our students, but how do we measure that? So this is also about measurements. And we would encourage you to conduct these 6 therapy sessions, because whatever is taught, how do you know you're doing it right and what is the effect on students? So the best way is to try it yourself and seeing that it works. And before we end the course, we will meet again for a couple of hours to just share our experiences across and see what kind of benefits we were able to produce in students. So this project work is going to be very much a integral part of the whole therapy course. So just to conclude, These are really the objectives of this whole respiratory therapy workshop. A equipping teachers to understand their participants beyond the physical body. So understand the psychological makeup of a participant, understand the social makeup. Social meaning with whom does he or she interact? How does that interaction impact his or her mind? I'm sure Usha ma'am is going to give us a lot more examples, but just a simple example like a participant saying that, oh my God, every time I see my mother in law, I become almost breathless or I go into an asthma attack. So, this kind of a trigger. Now, how do you help the participant to deal with such a thing? And how can she resolve these issues in her mind? So this is really talking about psychosocial participant understanding, helping teachers to tailor make respiratory programs for healing. See, the reason we are providing such a variety of techniques is also because there is no one good way in which a participant or all participants can be addressed. So it is really a question of understanding the participant, understanding how that participant is going to, what are those trigger factors, how you can resolve them for that participant and bring about healing. And that may not be the same for each person. Using a very holistic approach to healing. So it's not about just asana pranayam, meditation also. It is understanding the participant beyond the very obvious. I'm sorry about that. Yeah. Understanding the participant beyond the very obvious and providing effective triggers for healing. The alternative methods of healing besides yoga that we plan to introduce, see, this is not going to make you an Ayurveda practitioner or a naturopath practitioner, but what it will give us is few leads or few tips on how we can really introduce these along with our yoga therapy. So the idea of this whole workshop is to provide teachers with multiple instruments which they can use with their students to heal participants. So this is basically a little bit just about the contents of this workshop and a little bit about the whole objective of why this workshop was brought about. So thank you, and over to you, Seema, with that.
Thank you, Megha. I think that was quite full with regards what we are going to understand in the entire program, what we are going to learn. As Megha mentioned, and as we all know, how much importance does COVID have in today's times? Like it's one thing that has engulfed the entire globe by that logic, if we say, and all of us have spent the entire last year and at various places all across the globe. Again, now these days, currently in India, Mumbai, we are seeing that the number of cases are rising. So, what COVID does essentially, before we understand what do we need to do for COVID, it becomes for as a yoga therapist or as a yoga dealing with a COVID participant as a yoga therapist, we need to understand what COVID does to the system. COVID is a viral infection, and as a viral infection behaves, it directly attacks on the immune system of the body. So, at the physical level, it gives you symptoms which are particular to probably that system, which is the respiratory system. But at the physical level, it also gives you symptoms at the general level, in which the entire constitution of your body is responding to that attack of the virus. So, your sleep, your appetite, your general mood, your dreams, everything gets affected. Your digestive system, your entire system as a whole is affected by it. Talking about the mental level, the mental emotional feature of the participant who's coming to you, who has just recovered or come out of COVID or is through the process of journey, has mental emotional complaints which are related to a lot of anxiety, fear, depression, sadness. The nature of the illness is such that you have to isolate yourself and you are confined in that space. how much ever large homes we have, still when we are human beings as a social animal, when we are restricted or confined to place, it has a lot of repercussions on our mental emotional status. At the mental intellectual status also, what happens to your orientation of people around you, of space, your general confusion in the mind, your memory, because a lot of participants who come, patients who are suffering or have suffered, complain of loss of memory, disorientation, confusion. So this is the entire range that is going to come to you when you talk about yoga therapy and especially dealing with COVID-19. So, what are the various principles of therapy that we are going to use? All of that we are dedicating one special session to it, where we will entertain and understand each and every aspect of the therapy, why of it, and first design what of it. What are our directives? What are our objectives? And how do we go about them? As Megha rightly pointed in the earlier slides, that unless and until a yoga therapist decides his or her own goal for the participant, the recovery will not go in that direction. So yoga therapy, when we talk about, we have to be very much directed. Like to give you just couple of principles. For COVID-19, what our objective is? First and foremost, as it affects the respiratory system, again, the range I said is from physical particulars to generals to mental, emotional, mental, intellectual, entire range of symptoms. The patient might be in the asymptomatic zone or the mildly symptomatic or moderate or severe. However, at whichever zone post the phase of disease, he or she will come to you. What will be your objective? Your first and foremost objective is the fact that there has to be ease in the breathing. So that comfort in day to day breath, Shvaas, as we understand, is our partner for life, right? Shvaas is our mitra for the entire life. So ease in breathing. What are you going to do for that? You're going to include a lot of kriyas which help exhalation, cleansing the upper respiratory as well as the lower respiratory tract. So cleansing practices, kriyas form the hallmark of the entire program. With that, you aim at lot of exhalation practices, because when we exhale, we are just not giving out carbon dioxide, right? Exhalation as a process also speaks about letting out the negative energy from the body, which in turn helps us breathe in deeply and take in the positivity from outside. So that's one principle, very important. Exhalation or removing the mucus or secretions out, that eases breathing. Just one more I would like to say at this point is, second is improving maybe your lung capacity. Lungs are spongy tissues. They are supposed to be elastic, right? But when the infection comes, when your lower respiratory tract is involved, then it works on their elasticity. And you want to regain that elastic nature of the lungs. And you also want to promote the entire rib cage and the supporting muscles to inhale and come up, or expand and exhale. Go with the flow of breath. That will form again a huge part, and a very important role of practices will be all your twisting and stretching practices that you are going to work on, emphasize on. So that is how you are going to categorically decide what is your goal in therapy with COVID-19. Participant is coming to you at various levels. How will you approach using your measures that we have, your set of practices, which range starting from kriyas to the relaxation, or because the system has been hit at the immunological level, and there has already the system is overworked. It needs to be given lot of deep rest. So this entire range, how we are going to use. Currently, we have an ongoing batch in which we are monitoring various parameters. And it's very heartwarming to see how participants come with feeling of stiffness, not just in lungs, but also at the level of mind, because the entire complex is there with the participant when he or she has suffered from COVID and is now in the process of recovery. Again, the recovery takes a time from 6 weeks to 8 weeks to 12 weeks to longer as well. So at all levels, it's very heartwarming to see how therapy plays a role. And more, we can talk about this in our entire session, but it's important to understand what principles you apply to the participant in designing your course for the participant, and what will be your parameters for follow-up. Apart from that, one important aspect I want to focus on, which is the readiness of the participant. Mostly when somebody is coming to the course or is opting for therapy, is at a little level of readiness in the mind. But there can be hesitation also, right? A participant can come to you because mother is forcing or the daughter is forcing the mother to please take up the therapy. How the readiness of the mind plays a very important role in receiving all that the therapist has to give to the participant. So, over the practices, how the practices of cleansing like Kriya and exhalation also help in letting go of that reluctance or hesitancy. How the readiness in the mind of the participant develops with the mantras, with the auto suggestions. There is openness, there is ability to receive, and likewise there is ability to breathe more, and mental state of mind is more open to go towards the process of recovery, which is the role of therapist, which the therapist has to highlight on and understand. And that's what we call going beyond the obvious. What we see will be just cough, cold, loss of sense of taste, smell, and maybe breathing difficulty. But beyond that, what we understand about the anxiety, about the fear, about various things, will be elaborating in the entire process, in the entire course when we talk about, and that will be very, very important. So just a small glimpse, and I think we'll move on to the next topic. Uh, I will put the spotlight on Usha ma'am. Thank you, Megha.
Hari Om. Actually, psychosomatic factor is a very big aspect of certain ailments, and particularly respiratory ailments. All these years, more than 35 years as I'm teaching, I've met a lot of people with different issues, and mainly on emotional level and mental level. There are a few things I would like to share with you. Main thing, all these years, the learning process was very great, as everybody's, each personality is different, and body is a mirror of our inner thoughts and beliefs. So every cell within our body responds to every thought we think, and every word we speak. Not only speak, but what you hear and how you respond to that. There is a very interesting incident I would like to share with you. Once, before the class, few participants were sitting, and at that time, one lady came and she said, somebody asked her why you were absent for few classes. And then she started describing that she has dizziness, could not stand. And then she said she has vertigo. The word the remaining participants, they heard, out of that one participant, she started saying, oh, I also had that fearful experience. And then the lady who was absent, who came, she started telling, this happened, then this happened. And that other lady kept on saying, oh, same thing happened with me also. Same thing happened. Nearly five things or five symptoms the lady was describing, this happened to her. And each time, uh, this lady would say, oh, same thing happened to me. I realized that this conversation, somewhere we have to stop, So some other subject we went, and then we started the class. In between, as class was going on, suddenly this lady who was saying that, oh, same thing happened to me, she had very bad vertigo attack, and she could not move her head. Whatever symptoms were told at that time, all the symptoms she started showing, and she went into panic, and she said same thing, whatever this lady describing us, same thing is happening with me also. For her, we have to do some counseling. We talk to her that how you hear and responded, same thing, you can change your response. That yes, this such and such thing has happened. So after some points, we talked to her, and really that whole in within 2-3 days, the whole attack was subsided. So many times, all these years, I felt that the psychosomatic aspect of any element is a very big aspect. There is one more participant. Uh, she told her experience that one day she went to meet her friend after a long time. So she took some flowers, bouquet, and she went to her house. When this lady, her friend, opened the door and she saw the big bouquet, immediately she was very angry and she said, you know, I have allergy of these such and such flowers which you have brought here. And see, now I am getting choked up feeling. I'm getting too much smell and I'm sneezing. She started sneezing. Within that 2 minutes time, as she was talking, she started coughing, got angry, and lot of panic. Then the friend who came, she said, okay, I will keep this aside and let me talk to you. So she kept the bouquet aside, and then she took her hand, both of them, they sat down, and then she said, all these things, what happened? She said, that smell is too much. I could not take that smell. That is why. And then while talking, she said, see, all these flowers are artificial flowers. No smell, no pollen. So whatever you think of is your imagination and maybe your assumption that these flowers are going to give me problem. For her also, not medicine, but talking and yoga has a very effective practices how to become aware of your response or how you respond to the things or how you react, and you can change through some meditations. And as yoga teacher, you must be knowing analytical, contemplative, and healing, so on. Many meditations do help to recover and become aware of your attitude. So these things also we will share. And as you start treating people, more than treating, you will be handling so many participants. That time, please note that everybody has some issue, and soft words, encouraging words, good suggestions, repeat the auto suggestions, and that will surely help. So that aspect also will be covered in this course. Thank you.
Thank you, Usha ma'am, for sharing some experiences with us. And with that, I think whatever we had to share with you in short as a capsule, we have shared. If you have some questions, please put them on the chat window, or you could just unmute yourself and ask.
I have a question, Megha.
Yeah.
In these times of social distancing and use of sanitizers, how is acupressure going to help? How can we do acupressure for the other person?
Yeah, so see, Tarjani, everything, you don't have to go and touch somebody and press somebody, right? Understanding the right points, understanding where the technique,
Okay.
one can teach a technique to a participant.
Okay.
In fact, people are teaching acupressure even online, and
Okay.
we are going to learn it in this course online. So
Yes,
not
that
by
that
the
is
teacher
okay.
coming and touching us, but by us
Yes.
understanding exact points, and if communicated precisely, the participant can also do the same.
Okay. Thank you.
Megha ma'am, I had one question
Yeah.
regarding the therapy sessions with the students. How do you go about it when I'm not teaching?
Um, as a teacher, when you're not teaching, you mean?
Yes,
Yeah. So, see, this whole, you mean the project work, right?
correct.
Yeah, yeah. So, see, this whole project work is meant for you to just get the whole experience of teaching those practices to people. So, if you are really not teaching today and unable to gather even 3, 4 participants, maybe we will club you with one more teacher where you could teach along with that teacher. We highly recommend that you find some participants and teach yourself. But if, because that's an experience for yourself, right? But if you're not doing teaching, then we can club you with somebody who's willing to team up and you could teach.
Ma'am, also because I'm not in Mumbai presently. So that is one of the reasons I said I'll check with you.
Yeah, so I think that whatever you are going to teach, many of you are going to do it online, isn't it? How do you find physical participants? We already have cases of COVID rising. I don't think we are expecting teachers to go and do breathing practices and pranayams with students live, because we
Correct.
can't ask students to wear masks and practice, nor can we wear masks and demonstrate practices. So the best medium to teach today is online. And believe me, it's a very effective medium. We've been using it for the last, I would say now, we complete 1 year on 28th March. So 11 months we've been using this medium with severely ill people, moderately ill people, different kinds of patients. And we find it has produced very good effects. So
Okay.
it
Thank
is
you.
possible to teach online. I hope that answers your question, Vijaya. Yeah, anything?
I just had a question. Uh, it- Sorry, my video is off, but can you hear me?
Yes, yes, yes.
Well, I was just wondering because as a yoga teacher, we do have pranayam. Of course, we teach pranayama and give a little bit of knowledge on the respiratory system and how it works and how we can maximize, our breathing potential and stuff. In this course, can we expect to go a little bit more deeper in terms of, respiratory therapies?
See, as we mentioned, this course is, yes, it is about learning techniques, but it is also about understanding the psychological, the sociological, the physiological aspects of a participant. So, in that sense,
Mm-hmm.
if you see, if you are not already doing that, it will be a much more holistic understanding. Now, if pranayam is already being taught, and we understand that all of you are yoga teachers, but what to teach where? For
Yeah.
example,
So it's more like a one-on-one, and that's what you said is the difference between therapy and, say, for
yes,
instance,
if
a
you want to
yoga
intensively
session.
administer therapy, yes, unless you have very similar participants all grouped together. Like we do have classes where we are running only diabetes patients together, only joint pain patients together, only COVID patients together. So if that kind of a scenario is available, then it's different. You have a small number and you can still cater to one-on-one requirements. Now, coming to your question, I'd just like to give an example here. So, when COVID started and people were all talking about, oh, how do we give treatment for COVID? And one of the yoga teachers, she said, oh, I've told my student that kuch nahi, ye sab theek ho jayega. You practice Mahabandha, it is a very effective practice. Now imagine that a student is gasping for breath. The patient is gasping for breath when she has COVID or he has
Yeah, oh
COVID.
dear.
Now, how they will apply any bandhas? Forget 3 bandhas. How do they even apply a single bandha or breathe even through one nostril when they are gasping for breath through both nostrils? So the
Right.
techniques you will apply in these cases need to be completely different. They can't just be standard pranayams. And believe me, in this course, we are not going to teach anything complex because they are patients. Let us understand that this is therapy. And the whole focus is on simplifying practices for patients. How practices can be made simpler and still patient can get large effect of those practices. So that's the whole objective of this course.
Great. And so, yeah, I mean, firstly, as you said, to understand the patient and, try to get the context, the social and the psychological context of the patient, and then administer the therapy, because every individual is different. And of course, we want to really take care and not push anything which may not be beneficial. So I guess that's the objective also, right? Like, because one is already possibly in stress, respiratory stress. So,
Yeah.
because I find that quite, sometimes overwhelming when it's not my expertise to kind of give therapy to anybody who has suffered from a respiratory ailment, so to speak. And so I hope and I suppose there will be enough training provided to, um, kind of administer proper
Yes.
therapy.
See, the thing is also as yoga teachers, we feel that more complex the practice or more advanced the practice, better is going to be the effect. For therapy, it might just be the opposite. The more you can simplify the practice and target it to the right place, and the more the participant has a feel good factor. Feel good plays a very big role here, much more than your regular yoga class, because that feel good is only going to lift the participant out of his entire ailment. So it's going to be physical, no doubt, but a lot of it is psychological, and that is somewhere we lay a lot of emphasis on.
Right.
Therefore, the mantras and the auto suggestions and the yoga nidra and the psychosocial understanding of the patient.
Can
Right.
I add something, Megha?
Sure, sure.
Yeah,
Yes.
so as a yoga teacher, when we are talking about a regular participant, we have in our mind as a teacher, and a lot of times it is the need of the teacher and maybe not the participant, that you want to give XXX number of practices to your participant in the class. And even your participant might feel that if I don't do this practice in my yoga class, then I don't feel too good. All of these definitions really change a lot when we talk about therapy. As rightly Megha said, when we talk about therapy, we are looking at a very personalized kind of a thing where our target, again, our direction is clear, our goal is clear, our aim is clear. And then the number of practices really do not matter, but what matters is what is that one practice or two practices that will give benefit to that participant, and not just at the level of the body. Again, the connection is driven from the body to the breath to the mind, and how that one practice will be able to give a holistic benefit to that participant. So not the number of practices, but which practice to choose rightly is will be the task of the therapist, and that will be very important. Thank you.
Right, right. Understood. Thank you so much. Thank you very much.
Yeah, I think here even one more thing I would like to very humbly say is that it is not as if we are going to teach you some rocket science, and it is not only about teaching. See, we are a group of yoga teachers who are going to come together to learn therapy. So yes, some things we will teach. Usha ma'am will share her experiences. We'll share anatomy, physiology, and we will also learn from each other's experiences. So we believe it will be a very rich process of learning as we share experiences and grow together in the whole process.
Yeah, that makes it sound even better. Thank you so much.
Hello, Mary,
I'd like
you
to
have a
ask a
question?
I'm Mary. I'm living in Ireland. I
Yes.
did my teacher training level 1 with the Yoga Institute in Mumbai. So my question is, the 8 hours project is the working with the case studies. Yeah.
Yes, yes. Working
So,
with a few participants, yeah.
We can do that after the course, yeah, or rather than during, or what way do you plan it?
It's like this, that we will complete teaching you everything that we have to teach you in the course.
Yeah.
And we also discuss parameters used for evaluation of patients, after which you will teach 6 sessions to participants just to get an idea about how the techniques are working. After you have taught, we meet only once to discuss what your experiences have been. So technically, the classroom training ends before you start teaching, and we meet once after you teach just to share those experiences.
Perfect. Thank you.
Ma'am, one question.
Yeah, Prerna.
So in this, can we group the participants, because you mentioned that there will be patients with different kind of symptoms. So being a therapy, so what I feel is one participant may require certain kind of therapy, and other person may require certain different kind of a therapy. So do you recommend participants to be in one group when we are doing the project, or like how to go about that?
Yes, we strongly recommend that you have participants together. We are not looking at large groups. Maybe even 3 participants are enough. Little more than that is fine. Because participants also heal each other. We exchange vibes, we heal, there is encouragement. Today morning, when I did my diabetes class, and the sugar level of one of the participants had come down, the whole class applauded for her. And I got several messages saying that, oh, we felt so encouraged, now I'm even more encouraged to see my sugar levels go down. And I find this happening every time we have a participant in the diabetes class who says my sugar level has gone down. At least 3 participants tell me that, see, next month I'll show you my levels are also going to come down further. So there is a lot of encouragement and exchange which happens. So we don't feel that you should isolate patients when you are dealing with them. Yes, besides teaching them together, you might learn little more about each of them by talking individually to them. And when you talk individually to them, whatever you pick up, that you can incorporate into the class. The participant who's going to benefit maximum from that will benefit, and others will benefit too. So normally when a new participant joins our class, the teachers always, even on online classes, make it a point to first speak to the participant, understand the participant thoroughly, and then only take them into the class. So it's not just a mass teaching. Even if we have 40 people in the class, the teachers would have understood each participant's requirements well. But we are expecting you to pick up 3-4 participants if possible. So with this, I hope that is all your questions answered, and you are all already on the orientation group. So if you have any more questions, please post those questions on the group. We will try to answer them further. Right? So we'll conclude the class with the Shantipat, Dr. Sima.
Thank you, Megha. So once again, let us get ready and prepare ourselves. Sit steady. Mantras, as we chant them, are irreligious as we understand. They are special combination of syllables that come together, producing a specific sound that is healing for the mind and body. In the Shantipat, as we conclude, we are going to include the Mahabratanja Mantra, which speaks about promoting health and wellness, which we also will learn in our course as we go ahead. So become ready, everyone. Steady your body. Take 3 deep inhalations and exhalations. Watch the state of your mind. The mind is becoming silent. The breath is flowing evenly. The body is becoming more stable. Keeping this connection of mind, breath, and body alive, listen to the chant, or you can chant with me the Shanti Mantra that takes us from darkness to light, from unreal to real, from lie to truth. Asato ma sadgamaya, tamaso ma jyotirgamaya, mrityorma amritam gamaya, loka samasta sukhino bhavantu. Om Trayambakam Yajamahe Sugandhim Pushtivardhanam Urvarukamiva Bandhanat Mrityor Mukshiyamamrita. Om Shanti Shanti Shanti. Om peace, peace, peace. Peace in the universe, peace with our neighbors, and peace within. Gently join your palms in the center of your chest. Bow your head down in exhalation. Open palms. Place your warm palms on your closed eyes. Let the energy from your palms travel to your eyes and face, the rest of the body. Whenever you are ready, you may open your eyes. Thank you, everybody.